my name is Jessica. I'll be your provider today. Can you please tell me your first and last name?
Matt Ellis.
And where are you?
Home.
And what is the date and year?
June 30th, 2024.
Okay, patient is awake, alert, oriented, appears to be calm, cooperative, maybe a little anxious. No distress, not malnourished, and skin is normal for ethnicity with no visible injuries or lacerations. So today we're going to do a neurological, a musculoskeletal, and an abdominal assessment. Do you mind if I begin?
Go for it.
Alright, so we're going to start with cranial nerve 1. Cranial nerve 1, we're going to test your sense of smell. So I'm going to have you close your eyes and you're going to cover your left nostril, and I'm going to put a scent under your right nostril, and you're going to tell me the best you can what it is.
Sweet mint.
Alright, and cover your right nostril and tell me what this is.
Gross patchouli oil.
Okay, perfect. So cranial nerve 1 is intact. So cranial nerve 2, we are going to test your visual field. So you're going to open your eyes. I have the Snellen chart for you, and you're going to tell me the smallest line that you can read. Cover your left eye, please. Okay.
LTFPH.
All right, and can you read the smallest line you can backwards with your other eye covered?
HPFTL.
All right, so both eyes' visual acuity is 20/20. Next, we're going to test for the red pupil reflex. Okay. And we're going to look at the nerve behind the pupil, if we can visualize it. So, red reflex is intact. All right, and no abnormalities seen. And then look forward. All right, intact in the left also. And no visual abnormalities. All right, next we're going to test the visual fields. So I'm going to have you look at my nose. I'm going to cover one eye, and you're going to tell me how many fingers I'm holding up, okay?
3, 1, 2, 1,
Same thing.
3, 1, 1, 2.
Perfect. All right, so cranial nerve 2 is intact. Next, we're going to check for cranial nerves 3, 4, and 6. We're going to look for perla and then accommodation and see if you can follow my finger and all this stuff. So look towards me. Pupils are equal, round, and reactive to light. Now you are going to follow my finger with just your eyes. And pupils are accommodated. That's my favorite part. Okay, so cranial nerves 5, 7, 9, 10, and 12. We are going to do a bunch of different facial expressions and taste. So open your eyes real big for me and close them real tight. Awesome, you can open your eyes, smile real big, frown, open your mouth real big, bite down, open your mouth again, move your tongue side to side, up and down, and close your mouth and stick your tongue out. Perfect. All right, so now you're going to close your eyes and you're going to tell me if you are tasting sweet, sour, sweet, salty, or bitter. Okay, you ready? First taste.
Salt.
Okay, second taste.
Bitter.
Yep, and last taste.
Sweet. Yay.
Perfect. All right, so now we're going to do cranial nerve 8. We're going to do the Weber and the Reiner's test. So first I'm going to ding this and put it in the center of your head, and you're going to tell me if the sound is equal on both ears, okay? Is it equal?
Mm-hmm.
Okay. So now I'm going to test each ear. I'm going to hit this again. We're going to put it behind your ear, and then you're going to tell me when you don't hear the sound anymore, and then we're going to put it in front of your ear, and you're going to tell me when you don't hear the sound anymore. Understood?
Yep.
You hear?
Mm-hmm. Okay.
Okay. And the other?
Okay. Alright.
Okay, so that is cranial nerve 8, that is intact. And next we're going to test for cranial nerve 11. So you're going to move your head and your shoulders against resistance. So please move towards the left and the right and shrug your shoulders. Okay, perfect. So all cranial nerves are intact, no abnormalities found. All right, so next we're going to go on to your extremities. So we're going to test musculoskeletal. Okay, so first I want you to put your hands out and put your palms up and down and up. Perfect. All right, so the rapid alternating movement is intact. And then next we are going to do the heel to shin test. So you're going to put this heel on this shin and bring it down. Perfect. And then that heel and that and bring it down. Awesome. All right, so next we're going to test if you are pretty much aware of your body and the things that are around your body, okay? So we're going to test for exteroceptive, proprioceptive, and I forgot the last word, cortical sensation. Okay, so I'm going to use soft, dull, or sharp stimulus. I'm going to touch different parts of your body. You're going to tell me where it is and what the sensation is, okay? So close your eyes, put your palms out. Perfect. All right.
Dull, left cheek. Sharp, left forearm. Dull, right forearm. Soft, left fingertip. Sharp, right fingertip.
Okay, and then next I'm going to touch your fingertip with either 1 or 2 sharp points. You have to tell me if it's 1 or 2. Close your eyes.
1, 2, 2, 1, 2, 1, 2, 2, 1, 2, 2, 1.
Perfect. All right. So all of those things are intact. So next we are going to look at your clavicle, scapula, spinal column, shoulders, and spinal muscles. Okay, so you can face away from me. Perfect. All right, so scapula. Okay, shoulder muscles are good. No abnormalities in the scapula or shoulder muscles. Going to test for spinal column. Okay, and muscles. Okay, awesome. Now you can face me again. And we're going to look at the clavicles. Okay, so abnormality on assessment in the left clavicle due to a prior AC separation. Right clavicle, there is no abnormality found. All right, so we're going to take a look at the joints and we're going to do range of motion. Okay, so I'm going to check the wrist, hands, inspect and palpate. Okay. Close your eyes. All right, I'm going to move your fingers up or down. Is it up or down?
Up,
And what about this side?
down.
Perfect. All right, so all that is good. We're in the range of motion, so do what I do, okay? So arms up, arms down, arms behind your head, behind your back, palms up, shoulders back, forward, wrist up, wrist down, flip, wrist down, wrist up, big fist. Perfect. All right, and now we're going to do your pulses. Okay, I want you to push towards me, okay, and pull back. Push up, push down, squeeze my fingers, push, push, pull. Perfect. Okay, what happened? Oh, hold on, let me make sure it's still going. Okay, sorry. All right. So strength, range of motion, all intact. No abnormalities. Pulses are all present and expected to plus or +2. And no joint deformities or anything that are assessed. So I'm going to look at the joints on the knees and ankles. Okay. Awesome. I think that's it for that. Oh, reflexes. Okay, so the part I'm terrible at. All right, so we're gonna test for different reflexes. Nice and relaxed. You gotta feel it. Okay. Okay. And the brachioradialis. You have one reflex. That's about it. All right, and then we're going to test these reflexes. So nice and relaxed. Nope. Nope, you have no reflexes. Okay. Well, you know, abnormal findings. That's totally fine. All right, so next we are going to test your plantar reflexes. So you can lay down on the sofa for me. I'll move this. Oh, sorry. Have a seat. We didn't test for the part of the proprioception and whatever that word is. Close your eyes. I'm going to put 3 items in your hand and you're going to tell me what they are.
Tweezers
Perfect.
in my left hand. It's a key in my right.
All right.
Paperclip in my right.
Yep.
Key in the left.
Okay.
Tweezers in the right.
Perfect. Okay. Now we will move the chair and go back to reflexes. Sorry about that. Okay. Lay down. All right. So my patient is super, super ticklish. So. Okay. You just have no reflexes. That's fine. All right. So I'm gonna look at the hip joints. Okay. Okay, so we're going to assume that I palpated the hips. Okay, so let's do range of motion. Oh, sorry, let's do strength. Okay, so push away, push and pull. Perfect. All right, so now you're going to lift your right knee to your chest and put it down, and the left knee to the chest and put it down. Make a 90-degree angle with the left. Bring your heel in and out. All right, perfect. Put it down. Now the left up, in, and out. All right, put it down. Now as far as you can, you're going to bring the left leg out and in, and the same with the right, and in. Okay, perfect. Now I'm going to lift this leg, and you're going to move your other leg under and out. Perfect. And under and out. All right, so abduction and adduction are present. So now I'm going to check your pulses in the lower extremities, okay? Okay, pulses are present, +2, which is expected. So now I need you to face down. Turn over and face down. Okay, you're going to bring the right foot up, backward, no, the whole leg. The whole leg. Okay, and down, and this one up, and down. Okay, perfect. You can turn back over. Now that I got you all spun up, we're going to do the abdominal assessment, okay? So on inspection, so he can keep his shirt down, there's no abnormalities, no scars, no bruising, no discoloration, no redness, no rashes. So next I'm going to auscultate. So I'm going to auscultate all 4 quadrants of the abdomen, and I'm also going to auscultate the vascular. So I'm going to auscultate the aortic, renal, iliac, and femoral arteries, and make sure there's no abnormality. Vowel sounds are present in all 4 quadrants, and no bruit is auscultated in any of the vascular areas. So next we're going to percuss in all 4 quadrants, and then we are going to percuss the liver and the spleen. So I should hear a tympanic sound over gassy areas, and then I should hear a dull sound over the solid, there we go, areas. Now I'm going to lightly palpate. Is this your normal belly?
Yep.
Okay. Abdomen is soft, non-tender, and now I'm going to deep palpate. Okay, awesome. You can sit up. I'm going to palpate the kidneys. Any pain or soreness?
Mm-mm.
Not tender on either side?
Nope.
Okay, and you can sit up straight and palpate the aortic artery. Okay, awesome. So you can stand up for me. The abdominal assessment is normal. There's no abnormalities, completely unremarkable. So hands at your sides and feet together. Feet together. All the way together. We're doing the Bromberg test. Okay. All right, perfect. You're going to close your eyes, and we're going to assess for any swaying. So 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Perfect. All right. You can open your eyes for a second, kind of get your bearings. You can put your feet shoulder width apart, palms up. Perfect. And close your eyes. And this one, we are looking to see if there's any drifting in the arms for 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. There is no pronator's drift. Okay, so you can arms down. All right, so come stand by me. And you are going to, on your toes, walk towards the end of the sofa. And turn around. And on your heels, walk towards me. Beautiful. And heel to toe, you're going to, that's this, okay? You're going to go towards the end of the sofa. Awesome. And turn around and walk normal towards me. Okay, so gait is steady. There is, you can turn around, no abnormalities. Overall assessment of the patient is awake alert oriented. He is completely unremarkable with the exception of having no reflexes and the prior AC joint separation.
Never been so insulted in my life.
It's not an insulting thing. It's good to be unremarkable. That means you're normal. Okay, so that is it. Thank you very much. Yay.